Welcome back to Portland today. It's been a year since a groundbreaking mental health emergency facility opened here in Portland, and it's really a wonderful thing, you guys.
Yeah.
Some of Portland's biggest healthcare providers came together to create the Unity Center because it's really just such a crisis of mental health, not just in our city, but really across the country. And joining us to talk about how it's going, some of the things you've seen, is Unity Center Vice President Dr. Chris Ferentinos. Thank you very much, and thank you for what you did.
Oh,
Yeah.
I mean, so needed.
thank you so much. It's so exciting that we actually opened a year ago, and now we are open 24/7. Unity Center, it's a center that has a psychiatric emergency service 24/7. We also have inpatient, but think about as being a place where it's for anybody who's having a crisis. So from the girl next door who is having a panic attack to the individual that has a chronic mental illness that is having a flare-up in their paranoia, to somebody like a businessman who lost his business and is contemplating suicide. I mean, that happens.
Of course.
We are the place that that these individuals can come.
What types of services do you offer at Unity that maybe people can't get at a hospital or another type of treatment facility?
Yeah, so what's different about Unity Center is that we cater to mental health. So we have psychiatrists and psychiatric nurse practitioners that are available 24/7 that can do an assessment. Then we have social workers that can work with the individual and the families to connect them back to the community, to the right services. So that's another service that we provide. It's really that connection, that back door where people can be connected in the community with services.
Are we often talking about therapy? People need someone to just talk with them and work them through things, or is it just as often medication needs to be prescribed?
It's both. It really is both. And then if you think about also stressors that normally trigger a flare-up in a mental illness or an addiction, it can also be sometimes socioeconomic issues. It can be homelessness. It could be. It can be a divorce. It can be. So you have these triggers. So it's a combination. In psychiatry, what really works well, it's a combination of therapy and medication.
And the bottom line is, before, people didn't have places to go in an emergency situation, and you're not going to get what you need at the hospital. The
Exactly.
police are not always equipped to deal with this kind of thing. So
Exactly.
you guys really fill a void in the community.
Absolutely, and for the people that are watching the program, what I really would like everybody to hear me say is, as mothers or fathers, etc., is that we are open for everybody, regardless of insurance, regardless of payment. I mean, it's like we can really see a full range of individuals that need help that can come to us.
Are you telling me as a dad, I can pick up the phone and there's something that I'm concerned with my daughter, for example, I could reach out to you?
You can reach out, or you can even drive your daughter to us, and then your daughter will be seen.
Well,
Yeah, that's easy as that.
Sounds like Tracy said, you're really filling a void. Do you have plans to expand and maybe offer services in other locations or to more people at some point?
Yeah, we do, not in other locations, but to more people for sure. I think the first year we're seeing about 30 individuals a day that are
Wow,
coming into
okay.
the psychiatric
That's a
emergency
lot.
service.
Yeah.
We also have 102 beds, and we are going to be expanding the number of beds that we have. This first year we learn a lot with our operation, and so we decided that it would be best for us to have a few more beds because some people need inpatient, but the majority of the people that come to Unity are discharged the same day from our emergency service. So basically we're able to, 80% of the people that come to us, discharge them safely back to the community with a plan, with a plan so the family can help execute.
That's wonderful.
Part of the solution right here, and we thank you, right? This is what we need.
Absolutely.
Thank you so much.
Thank you for
So
coming
grateful.
and talking
No,
about it
thank
again.
you.
Unity Center for Behavioral Health.